Hello, everyone, and welcome to another episode of the On Meaningful Work podcast. I'm very lucky to be joined by Dr. Armida Fernandez, who I think I've had the honor and the pleasure of knowing all my life, really, because Dr. Fernandez is uh, a relative and a close family friend. Um, So, Dr. Fernandez is the retired dean of the Lokmanya Tilak Municipal General Hospital in Mumbai, where she was head of the Department of Neonatology. She is also retired as the medical director of the Holy Family Hospital in Mumbai. She is the founding trustee of Sneha, an NGO working on health, nutrition, and violence in Mumbai's urban slums. She is also the founder of the Romula Palliative Care Center. Her key areas of expertise and interest are promotion of breastfeeding and care of newborn babies, especially among the urban poor of Mumbai. She started the first human milk bank in Asia and has developed many low cost techniques for survival of newborn babies. She was named an Ashoka Fellow in 2004 and is the past president of the National Neonatology Forum. Dr. Fernandez, thank you so much for joining me.
My pleasure, Rahul.
Yeah, it's
And I,
we had a bit of a we had a bit of a we had a few technical issues, but glad we're here finally. um, so I think to start off, Dr. Fernandez, like when you hear someone, read out your bio or mention your past accomplished, or even when you look back on your career, uh, what are the feelings that does that evoke for you? Like,
I think when I look back one on my life or my career, I think lots of good things. I've had a very good, satisfying sort of a career which I enjoyed very much. I think every minute of it, I would do it again. And when I look at my life, of course, I've had good things, lots of good things happening. I've had a lot of challenges, but somehow I've been given the strength to face those challenges and in many ways translate those challenges into something that I could do that it could overcome those challenges. So I think like most people, good things, not so good things, but I think as I look back, I think quite fulfilled with what I've done in my life.
mm, yeah, that must be a great feeling. So maybe take us back to the start. Where were you born and where were you brought up? Yeah.
So I was born in a little town in Karnataka. It's a small township called Arwar. And
Mm,
there it was a beautiful little place, just cottages and flowers and trees and birds and butterflies. A college town, there were no industries, so mostly students and professors. And I was in a family of seven kids. My father was professor and then principal of that college. So it was a lovely place to be in, and I have fondest memories of my childhood and early days in Harvard.
yeah, that sounds amazing. It sounds very idyllic and sounds like a perfect place and time to grow up.
Absolutely, I can't. It's absolutely the one of the loveliest places to be in when you're going.
Hmm. And what was your schooling like? What were you like in school?
So in school, I think I was a very studious child. I studied hard right from my KG days, not really as I grew up, but and I enjoyed it. The point is, I enjoyed what I studied, so I loved my studies. I also took part in sports a little
Hmm.
bit and some games like athletes. I was a good runner and good at table tennis. So these were my, and so that was my. I had lots of friends. I think
Hmm.
the best part of my life is I received a lot of love not only from my family but friends through school and college. So it
Hmm.
was a lovely time in school too.
Hmm. That's awesome. And maybe just to touch on this, just before we recorded, we were talking about reading. Um, who- and you mentioned you loved reading. who are there any authors that come up that maybe when you look back on your life now, you might think that they sort of had an impact on you?
You know what? I think if you're a reader,
Mm,
in a lifespan, you go through different authors. So
mm,
when I was in school, started off with little Louisa May Alcott, Little Men, Little Women, and things like that. And
mm,
those days of Katie, the newer books that you have now, we didn't have those. And then, of course, there's a time when you go through all the possible detective books. So there was Sherlock Holmes, there was Agatha
mm,
Christie, uh, you know, Earl Stanley Gardner. So we went through that phase and then went through the other books that were available at that time.
mm,
But my father was professor of English and literature and Latin, and he sort of, when he was at home during vacations, he gave me all sorts of books to read. So I think
mm.
even before I finished school, I was reading on one side Thomas Hardy, Goldsworthy, Tim Dotowski, The Idiot, which you know, I don't know how
Wow.
much I remember, but yes, I went through all that. But I think, what I love to read were, they gave me a lot of pleasure. The others, of course, helped me, you know, your imagination. But I think, P.G. Woodhouse, even today,
Mhm,
I love to read. When I want to relax and I want to love
mm.
Lord Emsworth and his pink. So, so I've gone through all that. And, more recently, I think in the years of medical college and when you work as a doctor, you get very little time, unfortunately, to really read. So later on, Mitch Mills, I liked all historical,
Mhm,
archaeological novels. I went through that. Uh, I'm reading a lot because there's so much to learn in the new things that because now I do a lot of social, I'm in
mhm,
community practice, so lots of work on that and on palliative care. So
mhm.
yes, I read and moved on from early days to what it is now.
Yeah. But it's funny you mentioned PG Woodhouse. That's always, I think, a staple of growing up in India. It's like everyone.
Absolutely. Yeah.
Hmm. Um, and then what? How did you form the decision to become a doctor? Like, what made you take medicine as a young person?
You know what? I think even when I was small, I used to like that healing touch, and when anybody fell, I used to run and get something washed. We had that time we had Dettol, of course. Clean the
Hmm.
wound with Dettol and put some bandage in onto that wound. And I remember when little birds or puppies were hurt, I reached out to them, not knowing what to do. We didn't have good vets in those days, so I was
Hmm.
always reaching up to those that were hurt or ill. So when I
Hmm.
finished college, I decided I'm more not because I like the subjects of biology, like I or not, I love physics and maths, but because of what I could do with biology, get into medicine and then become a doctor. I think there was a craving from childhood to do something like
Hmm. And you mentioned you didn't like the subject so much. Like, what were the subjects that you did like in?
my favorite subjects in school and even in the first year of college was maths and physics. And
Mm,
I think because I was a very studious student and I liked those scores, I found it very easy to score in maths. It was, easy to get that 99 or 100 marks in maths. And it's a
mm,
question of hard work. People, it's not a question of, I think the harder you work and you keep solving problems, it makes it very easy. And second, physics. I felt there
mm,
was something in physics that I could pick up easily. So those
mm,
were my favorite subjects. I'm not so good at drawing, so
mm.
I didn't draw. Our biology, all those diagrams and things like that
Oh
was
yes,
not
yeah.
a favorite thing to do. So I never scored as much in biology. But
Mm,
like I said, I didn't know what would I do with physics, math, and engineering is nothing. In those days,
mm,
nothing that I was looking forward to. So I
mm,
chose biology because I said, my God, to see where I belong, wanted to become a
mm,
doctor.
mhm.
Against my parents' wishes, I must tell you, neither my father wanted me to take English literature. My mother
Mm,
wanted me to relax and enjoy life. She said, don't work so hard. Doctors have to work so hard.
mm.
Those were parents in those days,
I
Rahul.
know. I was just thinking that it's the complete opposite of today's. parents, especially today's Indian parents.
Correct, correct.
um, and so you ended up taking medicine, and as a medical student, did you enjoy studying medicine? Because it can be quite
So I
tough in the
loved
sense. Yeah.
not enjoyed. I think the word I would use is I loved every minute. And I
Wow.
even on holidays, that
Mm.
my teachers were a little tired of me. I had to attend the outpatient departments and all. Come to diagnose, to start the treatment. I loved every bit. There's not only one subject I didn't like too much was pharmacology. And
Mhm.
maybe. But once I got into clinical medicine, I loved every
Mhm.
bit of it.
And in what year were you a student?
I joined the medical college in 1961 and I
Mhm.
completed my medicine 65, 66, my internship. Long, long
Sure.
ago.
Yeah. And I suppose at the time was there any, especially in India, was there any prejudice against women doctors, or did you face any of that at all?
There is, when I look around me, I think there's a lot of prejudice against women in India. But
Hmm.
if you ask me personally, in my family, I think as a girl, I was born after four boys. So I was
Okay.
totally pampered. I was made to feel very special by my parents, by my only one sister there, seven siblings, but by
Hmm.
my whole family, I was made to meet. And even in the medical college, I think when you study and you have the board and discuss. So I love to teach, so I used to teach a lot of my students. I didn't feel the prejudice, but yes, around me, when you're
Hmm.
looking at female patients, you're looking at the world way girls are treated. There's a lot of prejudice, and it
Hmm.
is better, but still exists.
Hmm. Sure. And then after you finished studying medicine, what where did you decide to go? Like, what was your career choices then? Yeah.
Yeah, you know what? I finished studying medicine, and my choice was to work in rural India, villages.
Hmm.
You have those dreams that let me be there for the country, work in the villages, and I joined the Sisters of Missionary that were there in Dharwad to help them and see because then they would go into the villages. But in that first few months when I worked there, there was a child I remember so well that was passing stools, an infant,
Hmm.
3 months old, and passing blood in stools, and I was thinking it might be an infection. But you also have a surgical condition where you can have baby crying and passing blood. But I was not sure, and it was just a dispensary. It was not even in a hospital. The child went back to the village, and when I inquired about the child 2 days later, the neighbor said, "Oh, the child went and the child died that night." And suddenly I
Hmm.
felt like, I finished my medicine, but I don't know enough about children. I can't
Hmm.
work in any village, wherever it is. I want to work without knowing more about pediatrics. And that's when I decided I want to specialize in pediatrics. So I want to go to a good institution. And then I
Hmm.
moved from that missionary hospital in Dharwad to
Hmm.
Mumbai, to
Hmm.
the Korean Institute to do my pediatrics.
Hmm. And then after pediatrics, you joined. Was it Sion Hospital, or was it?
You know what? I did my post graduation in KM. That was
Hmm.
what 3 years, and then I moved to the Lokmanya Tilak Medical College, where I spent 3 decades as a.
Wow. Hmm.
I tell you the best time of my life. That
Hmm.
really knew something, and it was a medical college, and it was a hospital, and
Hmm.
the largest hospital. Like when you have government hospitals that cater
Hmm.
only to the poor. So
Sure.
the dying and the desperate came to hospitals like Sion Hospital.
Hmm. That's okay. So yeah, it's so a lot of the listeners of this podcast, are from Australia. So maybe if you could paint a picture of what it's like in a government hospital in Mumbai, especially at the time you were there, from the 70s onwards. Like, what's a day in the life of you as a doctor there?
So let me tell you what that a government hospital is like. For one
Mm,
thing, a government hospital, especially we were a tertiary hospital. The Sion Hospital was the largest hospital, and we did not only a specialty but super specialty treatment. So
Mm.
all the people who were beyond Sion, the all the districts or the villages beyond that, all of them came to Sion Hospital, and the ones within around Sion Hospital. The Sion Hospital, the largest slum in Asia, Dharavi is next door. Across the
Mhm.
wall of this is this huge slum. So all those patients came to. So the type of patients that came to Sion Hospital were really the poorest who could not afford treatment because this hospital had totally free treatment. You didn't have to pay for anything. So the poorest came. The second is the number of patients that came was because we could never say no. There was no one came by appointments. They got up
Mm.
in the morning, they didn't feel well, they just got up and came to the hospital. So there
Mhm.
was not, so I could be sitting in an outpatient, and normally I would say in Australia, all parts of the world, you see 10 children or 12 or 15 at the most. I could be
Mm.
seeing about 80, 90 children at one morning, and they're all crowded. No appointment would all come. So even
Mm.
an outpatient, you would be seeing patients, that's one thing. But in Sion Hospital, you couldn't say no for admission. So
Mhm.
when you say no, if we had a pediatric ward of say 100 beds, we could have 200, 300 children admitted.
Mhm.
So we had beds. I always say that the beauty about when I took up neonatology, we had babies on beds and cradles, and we had babies on the floor between
Mm.
beds in the corridor. So I said, despite
Mm.
all our ingenuity, we didn't know how to stick them to the ceiling. We would have done that if we could, but we had
Mm.
so there were no restrictions. It isn't easy to work in institutions like that, and it isn't easy to work one thing and to save lives or really do a good job of patients. And remember, these patients are not the educated patients, the ones who know what to do and how to do. So they
Mhm.
came with their background into the institution. So it's not. But what was I think the difference in a government hospital and a private hospital in India, and that's what happened in Sion is here you could reach out to the poorest. I mean, you made a difference in their life because they couldn't afford it. So they came to a
Mm.
hospital, and here is where we looked after them, saved their lives. So it's a different feeling altogether, that
Mhm.
you get. The other thing in hospital in those days, and that's why when you talk about what are the things, you said that low cost techniques,
Mm.
you don't have budgets to buy the equipment you want all the
Mhm.
time. You don't have enough staff, you don't have enough nursing staff, and therefore you have to use sort of ingenuity in how to deal with this and yet survive, make the
Mhm.
case.
Mm. And also, I was reading that when you joined, the infant mortality rate was really like shockingly high. It was around 60 to 70%. And could you talk about that and then how you brought it down?
So
Yeah.
if you're looking at infant mortality rates for the country at that, when I joined, it was 120 for the
Mm.
country. I'm talking about the country.
Mhm.
And when today it is 16. So, India has done a very good job of reducing infant mortality. I feel so proud about that. But when
Mm.
I joined Sion Hospital, I'm talking about 60 years ago, it wasn't
Mhm.
the mortality rate of infants or babies, but the sick preterm babies, the
Mhm.
babies who were really sick and they were preterm babies, they had a very high mortality. And
Mhm.
around, when I was there looking after these babies, there was no neonatology existing. We were all pediatricians. And because of that high mortality, I went to the head of my department. I was a young lecturer, and I said, "So we're having a very high mortality among our preterm sick babies, and we need
Mhm.
we need to do something about it." Do you know what he told me?
Mhm.
You look after them and see what is the cause and bring down mortality. So
Mhm.
overnight, when there's no specialty,
Mhm.
overnight I moved from pediatrics into neonatology. I said I'm going to focus beyond newborn. So without a
Mhm.
degree, really, just
Mm.
feeling for them, I became an overnight neonatologist and then worked there for the rest of my life.
Mm. Wow.
Yeah.
But also, I suppose, talking about, you mentioned ingenuity and these little things you had to do because you were so constrained in financing and resources.
Yeah.
Uh, could you talk about some of the things you had to implement just to?
So I'll tell you what we did. Today, of course, you talk about innovations and what is something new. At that time, we didn't know the word. We were
Mm.
pushed to the wall and made to say, "How think now? What can you do?" I'll tell you a classical example. When I
Mm.
started looking at only newborn babies, I first had to find out why did they die, and I
Mm.
found out the cause of death was infection. They died
Mm.
of infection. Then I had to find out what is the cause of infection. And therefore, started looking and I found that if we, the UNICEF had donated some incubators, 6 incubators to Sion Hospital, where our
Mm.
preterm babies were kept. And the moment you put the baby in the incubator, within 24 hours, the baby was sick, 48 hours, we lose the baby. So then I took cultures from the incubator and found they had the worst organisms, Pseudomonas, Klebsiella, growing in
Mhm.
those incubators.
Mhm.
And those incubators where you'd say, okay, growth, so you clean them up and reuse them. Wouldn't clean them. They had a old time, I'm talking 55 years ago, they had
Mhm.
water humidifiers inside. It was so complicated. We didn't have enough staff to clean. So I
Mm.
had to get rid of those incubators. I said, if I have to save my babies. And then,
Mm.
okay, you get rid of the incubators, how are you going to keep the baby warm?
Mm.
Right? So then
Mm.
exactly you have to think what is it I can do to keep our babies warm without. You'd say buy incubators. There was no money to buy
Mm.
incubators, so I use room heaters to keep the
Mhm.
room warm. And the smaller preterms, you won't believe, 20 rupees, warm, lamps of
Mhm.
different voltages depending on the size of the baby. And
Mhm.
because it was a medical college, all these topics to save babies were given to our research students so we make sure that we are really doing the right thing. And
Mhm.
then this is the way we change the policies. Another policy, the second thing I did, Rahul, we talked about human milk bank. The
Mm.
second cause of deaths where the babies died, got diarrhea, got
Mhm.
sepsis and died.
Mhm.
Where is the source of diarrhea? We're getting formula milk, maybe using bottles.
Mhm.
So then, and I'm talking about the early 80s. I
Mhm.
said, I'm going to get rid of formula, I'm going to get rid of bottles. I want
Mhm.
every mother to breastfeed their babies. And this was, years before the, baby friendly initiative by UNICEF W came in the 90s. I'm talking about the 80s. So
Mhm.
we got rid of the bottles, and I got the mothers in to feed their babies, express the milk for their babies. But it was what did I say? It was not a correct, really a good practice because I expressed the milk, kept it in the fridge in the thing, and then fed the babies. And that's
Mhm.
why I said, how can we have a really good scientific approach to ensure every baby in the unit gets, clean, sterile human milk, and that's why I started the Human Milk Bank in '89 in
Mhm.
Mumbai. It was the first in India, Asia, and I had a
Mhm.
lot of trouble to convince people about it. But of course, today everybody is having, every week there's someone starting a human. But in '89, had a lot of problems. But we started that, and they were, and as we introduced these things, mortality fell, Rahul. I'll tell you
Mhm.
another thing that we did. We had no nurses. We couldn't supply more nurses. So I said, why
Mhm.
do we need nurses? A mother is the best nurse. So I
Mhm.
changed the rules of the unit. I got every mother to come in to look after the babies, got them to express their milk, feed the babies, all the
Mhm.
procedures a mother could do. And the nurses, of course, did what was, the other IV suctioning, the other procedures. And I
Mhm.
think sometimes because I did the babies, mothers hold their babies and say, I want you to live. There is love goes
Mhm.
between that skin to skin contact. Doctors and nurses just prick the babies and make them cry. I think
Mhm.
mortality came down also because of that,
That,
the
yeah.
mothers being involved. So these
Mm,
are some of the many, many things that we
mm,
did to make sure that babies survive. And mortality really came down in.
mhm. That's an incredible story. But you mentioned that, say, looking at the milk bank, you had real problems convincing people of it.
Yeah.
Why is that, do you think? Like,
First of all, there was no money to start a milk bank, so I had to find a donor. So that's
mm,
what we got a donor. The Taj hotels that will fund it. But
mm,
in to convince people that you can give milk from another mother, they were shocked. They said, "How can you get one mother's milk to another baby, especially those who have to sanction this problem?" I didn't
mm,
have a head of the department all for it. Even the dean but I had to convince people because I needed staff in the long run. And then
mm,
I had to convince them with stories like, India had wet nurses all their lives. Even in those days, grandmothers, aunts. So I said you could have a wet nurse. So this
mm,
could be, and I had to quote actually the holy books of saying that Krishna was fed not by his mother but Yashoda. So
mhm,
I had to use a lot of skills to convince authorities that I
mhm,
should start a human milk bank, and that is, a way to save babies. So that's we did. It
mm.
required a lot of, like I said,
Yeah,
things.
it seems like all your reading of literature and physics and maths really came in handy.
Uh,
Yeah. Um, and I suppose then the focus really became on started to form around the health needs of women in slums because because working at a large government hospital, you were seeing some pretty horrific things, if that's, yeah, to put it mildly. Yeah. Mm.
I think that was, and you know what, Rahul, what happened was I focus was on these babies. They all came from the slum. You asked me the question that, did you feel women were discriminated against? And here
Mm.
in the mothers who came to our unit and to our preterm unit in ICU, if it
Mm.
was a baby girl, the in-laws, husband didn't come to visit that mother. And even if the baby was seriously ill, you just felt, look at what the mothers are undergoing, you know. And there were sometimes when the baby was serious, the mother would say, please discharge me, I have to go home. I said, why? Oh, who will cook for my husband? If I'm not at home, he'll marry another woman. So this is where you see that what our women were going through. So
Mhm.
I think that's where I felt. And the third thing I felt, when we struggled hard to save these babies, and of course, soon intensive care came in with all the uh, uh, things that come with intensive care later
Mhm.
years. And at that time, in the 90s, and at that time, we saved a lot of babies, preterm babies, even 800 grammars, 700. They went home and we said, wow, look at the
Mhm.
mortality. We've saved so many babies. But when we went home, many of them didn't come back. They
Mhm.
succumbed to it because the environment, they went back to those slums, the congested area, pollution, lack of
Mhm.
water. So, and some of the babies came back, but they came back with their own problems,
Mhm.
because of intensive care, uh, ROPs, eyes, some amount of blindness, deafness, and cerebral palsy if they had an intracranial. So the more I was in that intensive care area, I kept on saying, what is the point? We are here only when the babies are ill and trying. If we really want to make a difference to those babies and
Mhm.
prevent them actually from coming to the hospital, we need to move from the hospital into the slums where they live, where the
Mhm.
families are, communities, convince them to take better care of themselves, health of the
Mhm.
mother, come to the hospital on time. And
Mhm.
therefore, I was thinking, I need to move from the hospital into
Mhm.
the community at some point in time.
Yeah. And was this decision, was that a process over a number of years, or was there a catalyst event that happened and you think, okay, now is the time to act?
Now, I think it was over a period of time, and
Yeah.
Over a period of time, I felt very strongly for mothers and babies, and I wanted them. But I'll tell you a catalytic effect that helped me to take another decision. When I was a professor of neonatology, and we had one of those mortality meets that we have with gynecologists and the neonatologists, a 6 week baby was raped and brought.
Oh
And
no.
when I finally, because we were busy, I don't know what finally happened. Did they find the convict? What happened? Who raped the baby? These details I never, but at that time I swore to myself that when I get
Mm.
out of this hospital, I'm going to work on violence against women and children. And therefore, I
Mm.
always want to work in the community, the slums on maternal newborn health. This time I said, I'm also going to work on violence against women. And therefore, when I did
Mm.
start my NGO, child and then violence against women, that was added to the whole
Mm.
thing was
Um, and and I think, is that when the idea of Sneha came to you?
yeah, that's when the idea of came. I'll move with the
Yep.
slums.
Uh, Sorry, Dr. Fernandez. The I think the network is playing. Oh, that's better. Yep. Okay. And so how did you go about implementing this NGO? This, because you had an idea of what needed to be done. How did you go about?
I think you know that the path cut out for you and that you need to walk. And if you're deciding this is the way I go, God shows you the way. And when I
Mm.
when I always spoke about wherever I went, I want to work in the slums, and I don't know when I'll do that. And at one of the weddings, there was Rebel Sones, and he said, "Oh my God, Armida, you're always talking about working in the slums. I have a house. I'm going to sell it for some reason or the other, and you're going to take that money and start working in the slums." And I smiled and I laughed. And, but unfortunately, it's you know, level, had a massive heart attack and passed away. And a few months later, his wife Patricia and I said, "What are you talking about?" I just said, "No." When my husband was talking about this, I was somewhere away. I came, and these were his last words, saying that he would want you to work in slums. My words were, "You have got 5 children to bring up, and what are you giving me for something I've not even started?" She said, "No, this promise has to be fulfilled." And therefore, I said, I haven't started as yet. So, Patricia, you and I will get together and we will
Mm.
start an NGO. And that's how the actually Sneha was started. And I felt that God wanted me to work in the slums. He was telling me, this is your way. You have the money. You have Patricia with you and the two of you. And that's how I started. I found out how to start an NGO, what needs to be done. And then we had other people in my department as trustees. And that's how Sneha was started.
Yeah, and yeah, I suppose now Sneha has, grown to, I think a few hundred staff, and you have quite a large sum under management. But in those early days, how did you like implement the first programs, and like what is the biggest challenge there? Yeah.
You know what happened, Rahul, when to start with, yeah, you're right. I started with one single social worker. So, we started with one social worker. We started on, violence against women and a little bit on maternal newborn health. And over the years, Sneha is now 22, yeah, 22 years old. And
Hmm.
from that one social worker, we have a staff of more than 500 today. I
Wow.
started working in just one slum, that is Dharavi. We started working in Dharavi, the slum next to Sion Hospital. That's a
Hmm.
very famous sort of a slum. Everybody talks about the largest slum in Asia. Movies made in it. And some talk when Millionaire was made in it.
Yes. Yeah.
Yes, so people know Dharavi. So I started working there. We work across all the slums and the worst slums in Mumbai, and we not restricted only to Mumbai, the seven municipal corporations around us, and we work in other states as well. So it's really grown to
Hmm.
a huge extent. How do we manage? To tell you the truth, I myself don't know.
Hmm.
I must tell you that I'm a professor, and my heart beats whenever something happens. You feel strongly about it. But
Hmm.
I don't have the corporate background saying that how do you raise funds. I
Hmm.
never had in those days a fundraiser that you need someone to talk for you and all. People came round.
Hmm.
Unbelievable when you're doing work. And this is something I tell everybody. If you're working and you really feel strongly about it and you work with sincerity, heavens pour out,
Hmm.
people come from all over and help you raise funds. And I have people coming saying that can I have a play and so you can. I didn't know,
Hmm.
Babanu Kotwal,
Hmm.
who said, can I have a play? I said, oh, you can have a play. And someone says you can use my theater. And they collected funds. So I
Hmm.
didn't actively look around. But whenever we had, for example, we had a program, Violence Against Women, I went to the Tata's Foundation and explained it, and they were willing to come. And
Hmm.
then, the ICICI Bank, that is Patricia Soames, knew someone. And I
Hmm.
went and talked about maternal newborn health, and they said, yes, we'd like to work on it. It's
Hmm.
not that we didn't do anything, but we tried. But the funds came in easily at that point of time, but we were not a professional organization. And I
Hmm.
think the greatest blessing that we've had is that it's not just having funds, but it's having good people.
Hmm.
And Sneha is blessed with extremely good people. We have now trustees that are so involved in the NGO. We
Hmm.
have a CEO that is dropped from heaven, really good. But
Hmm.
as she's come from the corporate sector, she's changed the way she's using it like an organization should work. So everything is in place, done the right way. And all our, program directors who've been there for me from some of them from the time we've started, they're not even left. So we don't have people leaving so easily. So we have people
Hmm.
coming. I think that very committed people. So we are really blessed around with good people. A
Hmm.
third thing I think our blessing is because I've come from the government sector and
Hmm.
all the work we do is in partnership with the existing system. See, if you want sustainability and you want to go across, you can't work as an NGO. You have to work with systems. So
Hmm.
then the thing is taken up by the system and whatever we do. And we work with the government all along. So we partner with the government in all the government municipal hospitals, medical colleges. We partner with the police and their legal system for violence against women.
Hmm.
These partnerships have also been extremely good, and funders now from all over. I think they've done a very and they've come and helped
Hmm.
behind many ways.
Also, I think looking at Sneha, there seems just from the outside looking in, there seems to be a dual challenge in that you got to attack it from the top, in that you got to affect policy change, but also from the bottom, in that you've got to build trust in the slum itself and in the communities in the slum. So maybe let's start with building the trust. Like, how did you build trust in the slum? Like when you went in.
Rahul, that is such an important question. It's the most difficult. You go into the slums and you have your ideas. I want to do something about maternity born and you don't know what the people themselves want for themselves. So when you go to the slums, you don't go with, I've come here to teach you and I'm going to bring about change. If you have that attitude, nothing is going to happen. So we have a methodology when we go into the slums, we walk with them, we sit with the community, we discuss the issues, we find out what they would like to do about the issues, how they could do. Then we
Mm,
identify people within the community. It could be some sort of community leaders. So we work with them all along. And remember, it's not that they're learning from us. We're learning so much from them. The community teaches you so much. And it can't be over a day or over a year. It has to be over a period of time. And
Mm,
with each passing year, when the communities know that we are with them,
mm,
looking at all their issues and fighting for the issues with them and working with them for the issues, then that link between the community and the NGO starts. And I can give you examples. For example, violence against women.
mhm,
We had one woman who came in the early days, and
mm,
in a few years, her husband, who used to, be violent at home, he became a supporter, and he says, no, we must do something about this. And
mm.
we started men groups for
Wow.
violence against women. So,
Yeah.
they then all, they realize how important it is, and and the community itself, we collect volunteers. So we
Mm,
have our community health volunteers are from the slums itself. So there's
mm,
a whole set of community health workers who are from the slums. So they know the health issues, they work with them. But besides that, we have about maybe 800 volunteers from the community who are not paid.
mhm,
And, you know, that becomes such an important thing and was well seen during the COVID epidemic, where we were
mm,
not allowed to go in the slum. We couldn't go into the slum. But
mhm,
our volunteers were from the slums,
mhm,
and we worked closely with the government, identifying cases, helping them with rations. We did so much work. So this sort of a relationship is when they realize that we are listening to them.
mhm,
They don't have to listen to us all the time. We're listening to them. We are with them, working with them, and that they then see the change that is being brought about, not just by us, but by them themselves changing their behavior.
mhm. And I suppose another challenging thing working in, especially a slum in Mumbai, is how uh, diverse it is. In terms of religions and Hindus and Muslims and Christians, and a lot of these groups do not get along with each other. Uh, so, given that, how did you foster, I suppose, trust within the community itself? And,
I'll tell you something, Rahul. You know what happens? For example, a slum like Dharavi, we call it Little India. Every state of India is represented in Dharavi.
mm,
And also, like you said, there are different communities and there are different religions. But this religious thing is really a political division created by politicians, harnessed and then brought down into the slum. If
mhm,
you're looking at the slums as we work with these people, at that level of the slum, they're not fighting against each other. It's not that we're not talking to each other and all. At least in that time when we first started, they came together, but in the villages, you have community groups where, because the whole community is one community and it's easier to have groups. In slums, you can't have community groups. We have, lanes,
mm,
gully groups. We call it gully groups. Every lane,
mm,
because they're so busy, they work so hard, they don't know people lanes down their
mm,
line. So people in that lane know each other. They share the water, they do things together. So we didn't have, as far as I know, we didn't have clashes among the communities. Unfortunately, today, to say some slums are mostly one community. The
mhm,
smaller slums from another, so more or less they get on. But
mhm,
unfortunate part, these divisions are created by
mhm,
those who want to create it for whatever reason. But
mhm,
at that level, not as much.
mhm. And the other question is just with Sneha is this thing around growth and how you grew so quickly. What do you think, I suppose, fueled that growth? Was it just like how did you prove like, the success of the programs? What was a measure of success that you relied on?
I think the difference in Sneha, our NGO, compared to many NGOs, is
Mm,
everything that we do is documented
mhm,
and evidence based and research based. So
mhm,
when we start a program, we start what are our objectives, what are the results we want to achieve, and it's sort of a research-based project, and everything is documented. You will be surprised to hear. So we have a research team, we have a monitoring team, a huge team within Sneha that's doing that all the time. And you won't believe all our community health workers. They could be not past, they could have just passed school.
Mm.
All of them are using their mobile, you know, small laptops to document every day. So every house they visit, what is the weight of the child, it is all documented on their phones, and this is sent to the server, then analyzed on a daily basis, and
Mm.
there's a feedback to the community health worker and to the team. So
Mhm.
our work, I think what is the difference in our work, and the reason when you said is, you have to impact policy at the systems level,
Mhm.
because ours is evidence based, and therefore when we show that having done this, these are our results, and therefore this is why we should change the policy as far. For example, let's say malnutrition. This
Mhm.
is what we did for malnutrition. This is how we brought down malnutrition in the slums of Dharavi. You know,
Mhm.
so all this is documented, and when we show her them this evidence, then we can bring about change at the policy
Mhm.
level. I think that's what they do in Sneha, and I think that has made the difference. Also because the things are so well. I told you we have a CEO that is from the corporate, and many people now, even our trustees. So the transparency that they have, the way they everything that is done, whoever comes and sees how we work, and I think that brings in more funders today, and therefore we've managed to grow so fast.
Mhm.
Not too short a time, 22 years.
Yeah.
The last,
No, but I think what the organization has achieved in that 22 years is quite remarkable. Like,
absolutely. We have excellent programs. For
mm,
example, malnutrition that I talked to, we've done excellent work in malnutrition, brought down wasting and underweight children, all that we work on. Violence against women, excellent. I think all we've done, and the government and the legal system, the one-stop center that the government has, they asked us to run it. We
mm,
have in every medical college, government medical college, our counselors are there. We work with police and police stations. I think they're doing excellent work
mm,
in whatever projects. For example, the maternal newborn health, there was
mm,
no referral system. You have a
mm,
primary, secondary, tertiary
mhm,
levels of care, and there was no system of referral. So over the years, this is the system that we've laid down not only in the Municipal Corporation of Mumbai, but across 7 corporations.
mhm,
And this has been accepted by the system, and they have taken it over. So
mhm,
these are things that I think they've done an
mm.
excellent job.
Yeah, because the health system in India is quite fragmented in the sense there's hospitals, there's maternity houses, there's other things, there are other smaller clinics,
Mhm.
and and like you said, they're not all connected. Like they don't. Yeah.
Especially in a city like Mumbai, the private sector, there's
Mm,
a huge private sector that does whatever it is not well, uh, you know,
mm,
regulated. So
mhm,
we have a huge private sector as well that complicates things. And the poor, however poor they are, they feel
mm,
when you pay, you get better service, unfortunately.
mhm,
But even in the private sector, when the patient gets serious or really ill, they transfer to the government sector. So
mhm,
there are lots of things that happen in the health sector. But let me tell you, Rahul, when I see over the years, I think even I said we didn't have money in the municipal corporation, we didn't have staff. Today, the whole pattern has changed. They are doing an excellent job. If you look at the municipal corporation, the government hospitals, the staff, the funding, it has all changed.
mm.
So when I started 50, 60, it was a different story. But today, I think, and I'm so happy to see that. To see a lot of changes. They're doing a very good job. They did an excellent job in Mumbai at COVID.
Mm.
What a
Yeah.
wonderful job.
Mm.
So I think something that it's a case study to be
Mm.
recorded and to be seen by others.
Yeah, for sure. Yeah, that was really something. Um, just moving on from Sneha now. I suppose your next venture, if you want to call it that, was Romula palliative care, and that unfortunately came out of very tragic circumstances. Um, are you open to talking about that? Yeah.
Absolutely, absolutely.
Mm.
So Rahul, I started the Romula Palliative Care Center because I lost my only child, Romula, to
Mm.
cancer.
Mhm.
And although we were in a city like Mumbai and we went to the best hospitals and the best doctors, the focus was on curing and treating. And she was a case of Hodgkin's when she was 17, and this was breast cancer. In her 30s, she got this breast cancer. And the drugs were not working. I think it was post radiation that she got it.
Mhm.
And they kept on saying, moving from this to that. And I think the concept, maybe because we were both doctors, they never said this is something you can do. One of
Mm.
the doctors, a colleague of mine, did tell me, she says, maybe you should take it home and, convert your heart. But no one counseled us towards, and even the pain relief was not the best. And when we lost her, I said, why should parents go through all this? Why should a child go through all this? Why
Mm.
should there be so much suffering?
Mm.
And I looked around and I said, I'm a doctor. I first then came across that there is something like palliative care, and Tata Hospital had a unit, and I was not aware. And I
Mm.
said, why aren't you doing more about that? And
Mm.
that's why I said, when I said, I always feel, yeah, when you feel strongly about something, I said, this is something that needs to be done in the city. They
Mm.
don't have anything like palliative care, not enough at least. And
Mhm.
then I got in touch with people, and then I started the Romula Palliative Care Center.
Mhm.
And I realized that palliative care is not just for cancer patients, but for all patients with all life limiting disease. And therefore, it could be, stroke, it could be dementia, it could be Parkinson, chronic heart, lung. So we started a comprehensive palliative care center.
Mm.
Today, we're 4 years down the line. We're doing a phenomenal job. We have teams of doctor, nurse, counselors going across from Dadar down, north south of Mumbai, and we are
Mm.
now outpatient department in
Mm.
Bandra, and I think they're doing a wonderful job. And
Mm.
more important, I realized that enough was not being done. So we formed a palliative care network from Mumbai. And
Mm.
now, like lessons from Sion Hospital and lessons from Sneha,
Mm.
we are working with the government and trying to train the government doctors in palliative care, start OPDs in palliative care in government. So it's
Mm.
just a big thing. It'll take time, but we
Mhm.
want to, make sure that people receive palliative care.
Mm. No, I think.
Kerala's Kerala's got a bit like Kerala's a state all by itself, but they don't have good palliative care. But we don't have it in the city, and that's what we're trying to do.
Mm. Well, I think it's remarkable how you took such a tragic circumstance from your life and then created this thing to really make sure that others don't go through the same thing. Yeah.
I think that's what I said. When you come across something, to translate it into, if you want healing within yourself, you can cry and weep and get depressed. Now, doesn't help anybody. Doesn't help yourself. But
Mm.
we convert it into something positive, where
Mm.
then I feel that my daughter's death is, she died because this we had to reach out to people. We feel that it was, you feel, in a way, the healing process is much better
Mm.
when you can help other people, in
Yeah.
such.
Mm. I think that's really beautifully put, and I think the essence of a meaningful life is really taking your hardships and then seeing how you can bring value to someone else. Mm. Um, so I think just reflecting on, I suppose, just the stories you've said and your career and your history. If I were to ask a close colleague of yours, how would they describe you as a leader? What would they say?
Actually, you know what? Yesterday, a student of mine, not student, a colleague of mine, who
Mm,
worked with me for 7 months. She went to the UK and she came back to visit her mother and she came and met me yesterday.
mm,
And she said a strange thing. So it's a good question you are asking me, Rahul. She said, you know what? She told me, Dr. Fernandez, you know what I've learned from you as a leader, that a
mm,
leader, you don't sit at the top and tell people what to do. You work with them.
mm,
You work with them to see that whatever the vision is gets translated into action. And
mm,
she said that in that shot, and that you empower people to do things. And then
mm.
she gave me two examples I want to share with you. She
Sure.
said she said when I came to the unit, she had come from PGI Chandigarh. She reminded me that I wonder if she hears this thing, she'll be wondering how I'm quoting her what she said yesterday. She said, I came from a big institute and another institute, and there she said I was just new to Sion Hospital,
Mm,
and new intensive care, neonatal intensive care was being inaugurated. And I probably had to give a lecture some part of the country and I had to go. And she said, here I'm a lecturer. And I told her, you are the one, Divisha, you take over and you make sure everything goes right. And she said, my God, I was wondering what I'd do. And
mm,
then she said that the dean used to call her and she said, I must prove myself. And she said, when I came back and then we had the inauguration, she said, it went so well. And
mm,
then she said, she empowered me and made me feel that, I could do it because I trusted her and gave her that. So that's one thing she said. And the
mm,
second thing she told me is that, we needed something, dustbins for the unit. And that, like I said, you can't give it's a long process to get it. So I
mm,
got some funds from the doctors in the hospital and I took her with me to Profit Market, which is where you get cheap the things for the unit. And she
mm,
said, come with me, we will go and buy it. And she said, and I think here's the head of department trucking to some market, getting the dustbins and coming to the hospital. She said, and now she's one of the joint directors in a big guy's hospital in UK. And she says, whenever I'm in this position and I decide, I think of how you were as a leader. So maybe this may give you an idea, but I think you're not really a leader because all the ideas can't come from you. You might have had a lot of experience, but even those, your colleagues, have so many ideas. So I think as a leader, you listen to people and
mm,
collectively you take decisions on what needs to be done. I think that's the true because all and different people have different strengths, use all their strengths positively to make that difference.
mm,
I think that was how the leader I was and I wanted to be. I hope I was that.
mm. Another thing that's really, I think, special about you is you have these ideas and you have these ideals of, whether it's improving conditions for newborn babies in a, massive public hospital like, Sion, or it's starting a milk bank, or really looking after women in slums, which are really, challenging problems. But between having an idea and action, there seems to be a very short gap. You have this ability to really transform ideas and ideals into action. Wh- where do you think that comes from? How would you explain that?
You know what? Rahul, I'll tell you the truth. I believe I have strong faith. I
Mm,
have strong faith, and I believe that God has a plan for you and sort of whispers in you, and it just sort of translates. I don't make an active decision. I have to do this, I have to do that, or all the planning. Now these people do 5-year plans and 10-year plans. No, I don't do that.
mm,
And I talk about it. I feel and I feel strongly. I talk about it, and I think as I talk about it, people come, and I don't know where they. I feel God sends them.
mm,
And one of the funders didn't give me who came to the US. He said, "Where? What is your 5-year plan?" I said, "I don't." He said, "Where do you get funders?" I said, God sends them, and he didn't come back to me. But this is what I this is US versus
yeah.
Armida Fernandez in Mumbai. But this is what I sincerely feel. I don't think you do it yourself. Some power that is wanting you to do, pushing you to do, and let things come into place. That's my sincere belief. I don't know.
Hmm.
Maybe
Sure. But also, I suppose when things get a bit tough, when you really need to, because I think a big challenge is convincing people to abandon the status quo, abandon business as usual, and try something different. But you have this ability to convince people. How would you explain that? Is it
I don't like. Oh, give me an example. Convince people about what is this around.
well, I think through your history, there's been many examples, like say starting a milk bank, uh, you know, going into Sneha, going into communities in the slum, asking people there to trust you. Um, it could be convincing donors. Yeah.
Yeah. I think because I think if you strongly feel about something, it has to come from within your heart. And if you feel strongly about it, automatically the right words come to the right person.
Mm,
There's no planning as such, but the right words. If you have to convince people, then you have to have this is what I want to do, this is how it can help. For example, if I had to convince someone about the milk bank, I would say, look at this, the way babies are dying. They're dying because of the type of milk we give them. And
mm,
therefore we need. And they get convinced that, this is a project worth doing. So I
mm,
think I think the feeling strongly about someone, I think automatically the words come to you and you try and convince. Also, let me tell you, when you feel strongly, you're also doing some background work. And today you'll
mm,
tell many people, if, my staff and the organization hear me talk, they do a lot of planning, they do a lot of baseline work, they do a lot of reading, they do a lot of research, what to be done, why. And today to convince people, you have the CSR, we've got lots of academic bodies, so you have to go really well planned.
mm,
So that's a different type of planning that one needs now to really get. That I think of the way it worked when I first started was my strong desire, feeling, and I'm doing it not for myself, but for the people who need it, and
mm,
therefore the right words come to convince people.
mm. A- and also, do you feel uh, what do you draw on for the courage to do that?
I was never afraid.
Mm,
Even now, I don't draw on. It's in me. I,
mm,
I, I've never. Maybe I owe it to my parents, my mother, who
mm,
made me feel. I think maybe that's the reason. That's a good question. It's making me think. When I
mm,
was young, and I think my parents did it to all the siblings, my mother used to say, she made me feel I was perfect. She says, "How well you walk,
mm,
how well you talk," and I really my walk is something you'd like to see watch. But she made me feel that I was good at everything I touched. There was no criticism as such.
mm,
I think this positive feeling that was given to me
mm,
made me, able to talk. For example, I can be, people get, stage fright. I've not known what stage fright is. I
mm,
can go anywhere, talk to anyone. There's no fear in me at all. I
mm,
think this is because of the positive uh, approach my mother gave me, saying that you can do, you're good at it, and things like that.
mm.
Maybe that's the reason. You made me think, but I think this may be one of the reasons.
Yeah. Um, and also, I think there's a question around resilience, because I think resilience and hope, because you've been through a lot in your life. You've had some real tragedies, and you've also seen, I suppose, the worst of humanity in the work that you do.
Yes.
Um, so so from where do you find that resilience, and what gives you hope? Mm,
I think my faith.
mm,
When personal tragedies and all, I think the important thing that to remember is certain things you can't change.
mm,
And what you can't change, you need to accept.
mhm,
And acceptance is the only way to take it forward in life. So that is for personal, what I went through personally. So, and faith, there is a reason why this happened.
Hmm.
God brought me into this world for a particular reason, and if I need to go through what I need to go through, I need to accept it. So that faith, and I think that's so important for people. I know less and less people have faith, but to survive this tough world, I think that's so necessary. At least it made all the difference to my life.
Hmm.
And when the resilience, when I saw things around me, see the women in the slums or mothers in the hospital, it made me, the resilience was because I said, I'm here because I need to do
Hmm.
something about it. I've been brought here because I can do something. And therefore, I work very hard to try and keep those mothers happy, to try and bring down the mortality rates. Also, more important than that, in a public hospital, talk to mothers, put your arms around them, make them feel there is someone with you. And this is, as a teacher, you not only talk to the mothers, but you set an example to your colleagues, to your residents. Residents, when they talk to me now, say these are the things they learned. They didn't learn so much neonatology, but how to feel and how to deal with. So
Hmm.
I think the resilience comes from, wanting to reach out and doing something.
Hmm.
Some,
And can you talk about hope? What gives you hope?
uh, what gives me hope? I think as long as I live, I'll always have hope. You know, yeah, as I
Hmm.
because whatever happens, and sometimes for example, things happening here, I can do something for things happening in my home. I can do something for people in my community or for people in the slums, and we're trying to do that. But
Hmm.
when you look at the world and see what is happening, say in our country itself, what's happening in the country, what's happening in the world, the wars, the things that are happening, what is it that gives you hope? And the thing is that the hope comes from the fact that all this,
Hmm.
there is a time for this and all this will change and the better things will come out finally. I think that is the way, and again, it is based on hope.
Hmm. That's great.
On faith, but not hope, but it's based
Yeah.
on faith.
And last couple of questions. Like this podcast is really about, I suppose, for people to think about the work that they put out in the world. Um, so it's sort of a two-parter. Like if someone's just finished college, or if someone's in a, I suppose, mid-career career slump, what advice would you give them around, around finding meaningful work? Mm.
I would say if someone has just finished college, what I would tell them that look for something that will make you feel good about yourselves and will make you feel happy. You
Mm.
know what happens that people, it's what you look for in life. I wanted this career because I'll make a name for myself. I want this a career because I'll make a lot of money. I this is the career I want to because I can, people around me will be so impressed. So these are the wrong reasons. You're getting into a career that won't give you that satisfaction. So you've got to ask yourself, what will really make me happy? And it
Mm.
doesn't matter, when people, it could be anything. I could be a teacher. I love to teach. So let me spend the rest of my life teaching because that really makes me happy. And
Mm.
therefore, that career may not give you all that money, that career may not give you, at least you are fulfilled because you've done what you want.
Mhm.
And the same thing with the mid career. Many people halfway through I know it happens all the time mid career. They've
Mhm.
gone to your career and that's not the way. They
Mm.
are stuck halfway and they don't know what to do, where to go. And I think they need to take that break and look around them and see what are the other choices I have in life. And what is it I can work? Would it that be possible? Would that make me really happy? That will that give me fulfillment?
Mhm.
And what I want to say is that when I talk to when I talk to women and whatever stadium I'm talking to people, and they say, "Oh my God, you've done so much in the slums and you've done this." It's not that.
Mm,
Each one has a role to play in life. When you come into this world, you have a role to play. You don't all, not everybody can work in slums or be in a hospital.
mhm,
Could just be a husband at home. But
mm,
when you're playing that role, if you enjoy it, if you you love cooking and you make the best and keep your family happy with the cooking, or create an atmosphere in the home that makes everybody happy, you happy. That's the role you have to play, and
mm,
you find happiness in it. Family is happy, and you should feel fulfilled. You
mhm,
can't be someone else. So
mhm,
don't choose a role. So and so, Rahul, you're doing this, and I want to be Rahul because you've got so many books in your library. Is that something I would like to do? And I said, no, but Rahul has the time. He loves books and he's reading. But I'm here doing something else that I'm enjoying. So you will be in your world and I'll be in my world. So
mm,
you have to you have to take time. And sometimes when you finish with college and you're wondering what to do, expose yourself to different things. You
mhm,
know, today it's very popular. Take that 1 year off. You
mhm,
know, it's
mm,
called they take time off. Which have never been allowed in our days. But at
mhm,
that time, you explore and find out what makes you happy.
mm,
Yeah, besides, I think that's what I would tell.
mm. That's great. And this is the last question, and maybe you've answered it in part already, but this is the On Meaningful Work podcast. That's the name of this podcast. What does the term on meaningful work mean to you?
So I think meaningful work would be if I can bring about a change in someone's life that is positive. What would be meaningful? If
Mm,
I see that the mother taking her newborn baby home,
mm,
after intensive, that smile on her face holding a baby, that would be meaningful to me. If I see that child in that slum and was malnourished and now the cheeks have come up, the weight has gone off, and his child is playing, that would be a meaningful to
mm,
me. If I see meaningful be when I see women, the community health workers from our slums, they
mm,
get transformed. They come, they don't know they don't know much. They're learning, and we have put them through a whole lot of training. And within a year or 2 years, they're completely transformed. I would tell them we can stand for elections we want. They can talk. They can do some. That would be that is meaningful. And now when I visit patients, palliative care patients in their home, and I see that dementia patients smile at me when I enter, or
mm,
I have someone saying, "Thank you, doctor, my pain is relieved." You
mm,
know, that is meaningful. I think that to bring about that change in someone's life, I think that's very meaningful.
mm,
Meaningful life to me.
mm. Wow, that's such a great answer, Dr. Fernandez. And I just want to thank you so much for making the time today. This has been such a great chat for me, and I think yeah, I think for a lot of our listeners as well. So really, thank you so much.
My pleasure, Rahul. Thank you so much.
Thank you for listening to this podcast. If you're enjoying and are learning from this podcast, please subscribe on YouTube, Apple, and Spotify. A great zero cost way to support us is to leave a review on Apple Podcasts and Spotify. If you are feeling extra generous, it'd be great if you could leave a comment or feedback on our Apple Podcast or YouTube pages. Or you could email your comments and feedback to me directly at rahul disruptivebusinessnetwork.com. That's RAHUL at disruptivebusinessnetwork, all one word.com. Finally, a big shout out to our producer Dan Scahill for his work on the keys and to Vashti Civil for writing the original music for our theme. Until next time, this is your host, Rahul Sones, signing off. Bye.